Hello everyone. So today we'll be studying the complications of twin pregnancy. So first starting with the maternal complication. So we'll divide it into during pregnancy or antenatal period, during labor, and in the during puerperium or the postpartum period. So starting with the pregnancy complications during antenatal period. So what are the first complication? The first complication is increased nausea and vomiting of pregnancy. Why? Due to increased beta hCG levels. So this one is the first complication. This is what we call as a hyperemesis gravidarum. So again, what are the next thing? So there is increased chances of anemia. Why increased chance of anemia? Due to increased iron and folic acid requirement by the two fetuses, number one. And number two is the folic acid deficiency alone can also lead to what? It can lead to megaloblastic anemia. Next, number three, there is also increased chances of miscarriages. Now coming to number four, there is also increased incidence of increased minor elements of pregnancy. Number five is that there is increased chances of preeclampsia and hypertension by 25%. Why? This preeclampsia and hypertension are very common. So this is increased by 3-fold times increase, and this is due to the increased exposure of the chorionic villi. Okay, number six, there is 10% chances of hydramnios, which we'll later on discuss why. And this mainly occurs in the second sac, and this mainly occurs in the monozygotic twins. Moving on to the next complication, that is antepartum hemorrhage, or first one is the placenta previa. So there is increased chances of placenta previa. Why? Because of the increased size of placenta, and there is increased chance of the placenta encroaching into the lower uterine segment, leading to what? Leading to placenta previa. And number two is placental abruption. Why placental abruption occurs? So number one is that it can be due to the increased incidence of preeclampsia, number one. It can be due to folic acid deficiency, number two. And also there can be sudden escape of liquor following delivery of the first twin. So following delivery of the first twin, there can be sudden escape of liquor, and leading to what? And especially the hydramniotic sac. And following delivery of the first twin, what happens? There can be sudden shrinkage of uterine wall adjacent to placenta attachment. Okay, so these are the causes. Now next, moving on to the next complication, that is malpresentations. Malpresentations are very common in twin pregnancy, and most commonly in the second baby. Now there is also increased chances of preterm labor. In 50% of cases, increased chance of preterm labor. Why? Number one, it can be due to over distension of uterus, number one. Number two, hydramnios. And number three, due to premature rupture of membranes. And these are the three reasons. And next, last complication is this increased mechanical distress because of the large size of uterus, leading to what? There can be dyspnea in the patient, there can be breathlessness, tachypnea, shortness of breath. So these are all the things. So moving on, what are the complications that occurs during labor? So during labor, what are the complications that can occur? So number one, there can be early rupture of membranes. Okay, early rupture of membranes due to increased prevalence of malpresentation. Okay, next is the early rupture of membranes, and they're leading to what? It can lead to cord prolapse. There can be cord prolapse. Number three, inefficient labor or prolonged labor. Though prolonged labor is a theoretical one, usually there occurs only early onset of labor. Okay. Number four is that there can be increased bleeding or PPH. Why PPH occurs? Because of the uterine over distension, leading to uterine atony. Number three, due to large size of placenta, taking more time for placental separation. Okay, so larger size of placenta. Okay, so there can be increased operative interference. And number four, there can be retained placental chances. Okay, next complication is what? There can be abruption. There can be placental abruption. So placental abruption leading to what? Why? Placental abruption, there can be sudden gush of liquor, sudden escape of liquor following delivery of the first twin, as we know. And what are the complications that occur in the puerperium? The complications that occurred in puerperium, and number one is the subinvolution. Why subinvolution occurs? Because of larger size of uterus taking longer time to involute, it can lead to subinvolution. Number two, there is increased chances of infection due to increased operative interference and increased prevalence of anemia. And number three is failed lactation because of excessive need of the two babies. Failed lactation. So these are all the complications that occur during pregnancy. Next, we'll move on to the fetal complications in the next slide.